Hi everyone, and welcome to HLSC 3001, Intro to Laboratory Techniques in Medical Assisting. We are starting on Unit 1 today, and that is going to consist of our standard clinical procedures. For this unit, we will be going over chapters 23, 24, and 36. So please be sure to read those chapters. I will be doing this lecture, however, you get much more from the content if you also read it from your textbook. So let's get started. As always, I have learning objectives listed here. So these are the key points, the key takeaways that you should get from this lecture. So just be sure to look over those because they often highlight what will be testing points or questions that will be listed on your quiz. Okay, so vital signs. We're going to start talking about vital signs, and in class we will actually practice vital signs. It'll kind of be our first skill that we go over. But vital signs are so important, and it's one of the most common tasks that medical assistants actually perform. And these vital signs include temperature, pulse, blood pressure, and respirations. Those are kind of the core vital signs. But medical assistants may also be asked to obtain height and weight, oxygen saturation, and pain level. And pain is actually considered one of our vital signs. So it's really important that we develop some habits in taking vital signs. One being aseptic technique. So this includes things like hand washing, disinfecting the blood pressure cuff between patients, things like that. And in our day and age, you can never be too careful with this aseptic technique. Also, recognition and correction of factors influencing vital signs. So on the next slide, we're actually going to talk a little bit more about that. So accuracy. We want our vital signs to be completely accurate because the providers use these vital signs to actually create a plan of care for these patients. So they need to be correct. And lots of things can alter our vital signs. So if we're angry or if we're really anxious, if you've ever heard of white coat syndrome, if we've just eaten a large meal, things like that can affect how our vital signs are reading. For example, if we just drank a really cold drink or ate some ice and then got our temperature, it's probably not going to be accurate for our real core body temperature. So we use these vital signs, again, to create our plan of care, or the physician does. So it's really important that we get the most accurate readings for these and follow the proper procedure for each of our vital signs. So we're going to begin by talking about height and weight. And so if you've ever been to a doctor's office, you've probably had your height and weight taken at some point in time, maybe even if you were just a child. It's often part of an annual physical exam, and they're often taken simultaneously. So you may hop on the scale, and it also has a stadiometer that measures how tall you are. These are also, known as anthropometric measures. And to take our height, we obviously want to have the patient take their shoes off, especially if it's a woman wearing high heels or wedges or something like that. We want to make sure that they're flat-footed. We want them to stand with their back completely against the stadiometer or the measurement that we're using and have the head looking forward and straight. For weight, we want to realize that this is often a sensitive subject, right? And not just for those that are overweight, but also for individuals that may be underweight. Maybe someone has been suffering from an eating disorder for a long time and they finally are working through it, but it's still a sensitive subject. So no matter the size of the patient, always remember that that's sensitive. So don't go blurting out really loudly how much the patient weighs. You want to make sure your equipment is calibrated. So I will show y'all in class that scales can be calibrated differently, so it really depends on the kind of equipment you have. But we want to make sure that whatever equipment we're using, it's calibrated and ready to go so that our results are accurate. And again, we want to remove any shoes, any heavy items, nothing that will, again, give us an inaccurate reading. Now, along with height and weight, you may also, if you work with pediatrics, with those kiddos, and infants specifically, you may be measuring head circumference. So it is measured right over the top of the eyebrows here and all the way around. And this is a really important measurement for those infants because we want to make sure that their head is growing appropriately and it's charted on those growth charts that providers use. So moving on to temperature. Our body temperature is regulated by heat production and heat loss. So it's a fluctuating thing, always. We're always producing heat and also losing heat. And it's regulated by our hypothalamus in our brain. So something in our brain is actually telling our body, okay, we need to produce more heat or we need to lose some heat by sweating, those kinds of things. So our body heat is actually produced by both voluntary and involuntary muscles. So if you think about like when you exercise, obviously you get more hot, you get heat. That's voluntary. You're moving those muscles around and things like that. But you have also, when you digest, some of those involuntary muscles are actually producing heat all the time as well. And just note in our book, it also tells us the 5 processes that our body actually uses to lose heat. And those are convection, conduction, radiation, evaporation, and elimination. I'm not going to go into too much detail here about those, but know that they have those in your book, and those are the 5 different ways that we actually are continually losing heat through our bodies. So obviously our temperature is measured in degrees, and it's influenced by many different factors. Sometimes we can have a decrease in temperature by certain viral infections. If we're not using our muscles, we actually have a decrease in body temperature. So if we're just sitting still, we're not active, our temperature will decrease. Fasting, again, I just mentioned how our body, when it digests food, we create heat. So if you think about if you're fasting, you have no food in your body to be digested, you aren't going to be creating that heat. Obviously, exposure to cold. Our body is exposed to those elements, creating a decrease in temperature. Drugs that decrease our metabolic activities. Again, things are slowing down, so we're not creating that heat from those muscles. And also age. And then an increase in temperature. Sometimes our bacterial infections. So when you're sick, you often have a temperature. Increase in physical activity. Those muscles are moving and burning up. Food intake, remember, we're digesting, we're using those involuntary muscles. Exposure to heat, obviously, we're used to that here in Memphis. Pregnancy, drugs that increase our metabolism, stress, and severe emotional reactions, and also age. And speaking of age, infants often have a body temperature that is 1 to 2 degrees higher than in adults. Just remember that if you ever start working with pediatrics, that their temperatures seem to run a little bit warmer than we do as adults. Time of day also affects body temperature. What time of day do you guys think that your body temperature is going to be the lowest? If you're thinking early in the morning or while you're asleep, that is absolutely correct. Because if you'll think about it, that's when your body's had the most rest, it's the most still, and then throughout the day, your body temperature actually rises. And there's no normal temperature. There's only an average. So our average temperature is going to be 98.6 degrees Fahrenheit or 37 degrees Celsius. And it's important for you guys to know both of those because sometimes you'll work in an area that has a thermometer that reads in Celsius. So it's important to know that for Celsius, it's 37. That's that normal average temperature that we're going to go by. Here are some vocabulary words associated to temperature. I want you guys to take your time and read over these. I'm not going to go through them on this lecture, but I do want you to know these, and you may be quizzed over one of these words, so be sure to read through these. So let's talk about different types of thermometers. So there are many different types. There are disposable strips, and you may or may not have ever seen any of these. I'm going to move this here. These disposable strips are right here, and they are obviously one patient use, and you dispose of them after you've used them. They're not the most accurate measurements. As you may think that obviously they're just reading the top of the forehead, so there are different factors that can affect the accuracy of that. If the patient is sweating, if maybe they've had a hat on their head and then you just took it off, it may be reading warmer than what their actual core body temperature is. So just think about that and the accuracy between these different types of thermometers. Our next type is electronic or digital, and you'll see that here. And you can actually use these orally or rectally or even axillary, which we'll talk about in just a minute. but know that you can use these in different areas, but they're the same type of thermometer. So it's an electronic one, and it works. You just place it in and it pops up the number that it's reading. Tympanic or oral, I always mispronounce that word. It's going to be reading the tympanic membrane of the ear. So you'll see this infant here has the tympanic thermometer in their ear. And these you'll often see in pediatric offices, but you can also use those for adults as well. Let's see. For using the tympanic thermometer, you'll want to remember that for adults, you pull the ear up and back for adults. But for our infants, our ear canal is actually structured a little bit different as we grow. So for infants, you actually pull it down and back. And that's a big difference. So be sure to know that when you're using the tympanic thermometer. And then lastly, the last type of thermometer is a temporal artery. And it's actually measuring the temporal artery temperature from that specific artery. So you'll rub it over the forehead and it measures that through the temporal artery. Okay, as I mentioned, there are different areas to obtain temperatures. We often think of just oral, but now some of us may have experienced using the oral or the temporal artery in different places. If you go to work, maybe they use those kinds. Now they even have the no-touch ones that just go to your forehead. But there are different areas. So oral is, the most common, usually for adults. Rectal, we can take a rectal temperature. Axillary, you can actually see in this picture, axillary is underneath the armpit, and you can use this to obtain a temperature. Tympanic, we just spoke about, is the inside of the ear, reading that tympanic membrane inside of the ear, and then our temporal artery. And here you'll see that the different ways to chart or record our temperatures, how F is for Fahrenheit, C is for Celsius, and all the rest that are listed here. I'm quickly going to introduce pulse, and then we'll jump over to a new recording to complete the rest of our lecture. But to obtain pulse, or what a pulse actually is it consists of two phases of our heart. It's when our heart contracts and relaxes. It's reading that pulse rate. And it's felt when we're compressing an artery. So we're actually feeling that artery compress and relax, or contract and relax. I'm so sorry, guys. And here you'll see our picture of some common sites that you can feel our arteries. And I actually want y'all to take some time and feel your arteries on your body. So feel for that carotid artery. Feel for your brachial artery and your radial artery. The radial is the one that we'll use the most, and we'll use it in class. And that's the one that we'll actually obtain on our partner for feeling their pulse rate. The last one I want to mention is the apical pulse, and this one's a little bit different. You'll notice that it's here on the chest. It's actually located at the 5th intercostal space at the left midclavicular line. I know that's a lot of words, but if you think about it, those intercostal spaces are in between each rib. So you're going to go down 5 ribs, in between 5 ribs, so down that way. And it's on the left side, obviously where our heart is located, midclavicular. So your clavicle is your collarbone, so midclavicular line and down. So it's kind of, for women, kind of where that bra line hits at the bottom. And that's where you find that apical pulse. And it's the only one that is not actually felt, but it's listened to. And you use your stethoscope to listen and count those beats. As for the others, you actually feel and count that pulse rate. We'll talk about that a little bit more in our next slide. So take some time, digest this information that we just went over, and I will see you guys on our next video.